It's very exciting to be recognized as the Castle Connolly Rising Star. It's a great feeling to know that my peers have recognized me as a physician who gives, great evidence-based care and is also able to provide my patients with a safe space and a feeling of being treated like an individual. As a physician, I know that there's a lot that goes on behind the scenes and a lot of things that maybe are not, that patients aren't aware of, that, other physicians kind of know, and that a physician recommendation is very meaningful because it means that there's a certain level of respect and of, confidence in what's going on, not just what the patient sees, but really behind the scenes. And so to be peer nominated is very meaningful, to know that not only are, the patients giving, important good feedback, but that the physicians who really kind of understand and have the insider view agree with that. I entered college, I went to an engineering school, and it was because I excelled at math and science and I didn't love writing papers, and so I felt like that was a really good fit for me. And I didn't initially know that I wanted to become a physician, but as I went through the engineering program, what I found is that there really wasn't enough, personal contact involved. And so it made me think, how can I use my skills or my talents in the scientific fields to really have more of a personal touch and impact people in a more of a social environment. And so it was actually an easy transition to consider medical school because, I had done all my science courses and I did some shadowing and volunteer work and realized that that was really the perfect harmony of being able to use science and also forge close relationships in meaningful ways with people and make a career out of it. So that is where my decision to become a doctor came from. And once I entered medical school, I actually knew right away I wanted to do OBGYN. I love working with women, and I love the intensity of the relationships that are made with your patient. So every patient that comes to see a fertility doctor has a story, and is different, and you really need to work to understand each patient's road and path to get to you and how they see treatment unfolding for them. And it's different for everybody, and it's because of the experiences they've had that leads them to, want to partake on their journey of, fertility workup or treatment in a specific way. And so ultimately, when they come in, the initial consultation is really important to get to know the patient. So I really try to learn about their lives, and I ask a lot of questions that may not seem directly, medical related, but really try and understand maybe their relationship dynamics, or, if they're, single, or if they're trying to do fertility preservation or explore single parenthood or something like that, to understand, the journey to come to that and what that means for them. So I will spend time getting kind of a background and an idea of really more of their personality, their views on life, even because it's a really intense field, emotionally. Even the most relaxed person in the world ends up with anxiety when going through infertility. And then if you're anxious to begin with, it can really spiral very quickly. And so as a fertility doctor, part of our job is to be able to allow them to almost transfer some of that anxiety onto us and be able to relieve, take it off their back and say, we're going to help you. You don't need to hold this load anymore. Give it to me, and together we will, go on this journey together that on a pace that you're comfortable with. So when I speak with, trainees like medical students, residents, I definitely try and instill in them the importance of choosing a field that's right for them, that makes them feel inspired and kind of take them out of maybe the more routine, tough sides of medicine that can sometimes bring you down, and be able to pull them out and give them some sort of motivation and light and feeling of purpose. Also, I like to think of it in terms of, what kind of situations do you like to be in? Like, do you like, quicker interactions? Do you like these deep dives into patients' lives, like what I get as a fertility doctor? It's definitely not for everyone. And also, like, not everyone likes to be in emergencies, for example. Does the adrenaline give you, a thrill, or does it make you anxious? So I think that there's a lot that goes into choosing the fields that has to do with what your personality is, and what kind of you seek happiness from. And so I definitely would try and stress to keep that in mind, so that you don't go into a field maybe for a lifestyle or a paycheck or this or that, but really a field that's going to maybe give you, some of that, but it's not going to be enough. You have to love the fields. And that's really where I'd say I've gained all my satisfaction, is really through my patients, and I feel lucky that I was able to find a field that was able to give me that.